welcome in. So sorry for the delay. I've had a lot of patients scheduled today and we've been a little bit behind, but I hope you don't mind too much. Okay, so I see here on your chart that you've been dealing with some issues with your cranial nerve, you think? Okay, so tell me a bit more about what's going on. Okay. Okay, a little bit of numbness and tingling there. Which side is that going on with? Okay. Have you had any changes to your vision? Alright. And what about when you're exercising? Do you feel like you're having any heart palpitations or difficulty breathing? Okay. Well, that's good, that's good. No, it doesn't really have anything to do with the cranial nerve, but I just want to also make sure that you don't have anything else going on here. Well, what you're describing seems pretty typical with issues with the cranial nerve, but I can't 100% say that it is the cranial nerve that's causing these problems for you until we give you the cranial nerve exam, which is what we're going to go ahead and start today. The good news is that if you do have an issue with your cranial nerve that we discover in today's examination, there is medications available that I can prescribe to you today that will help with the inflammation of the cranial nerve. And if those don't work, there is a surgery available. And that surgery has a really high success rate, very low risk. So there's nothing to worry about. But what you're dealing with could be symptoms of potentially another illness or another nerve issue. So we want to go ahead and see today if we can rule out the cranial nerve, or if we're going to discover that the cranial nerve is the culprit. Okay, so before we get started here, just a little bit of information I'm going to need to gather from you. What's your name? Okay. And what is your date of birth? Okay. Are you currently taking any medications? Okay. No, that wouldn't be causing the problem that you're talking about, so don't worry about that. What about, has there been any changes to your insurance? No? Okay. What about any changes to your address? Okay, good. I have a little questionnaire here that I do have to fill out since it's been the first time seeing you in a couple years. It'll be super quick and easy, but it's basically just some physical exam questions that are pretty routine. Okay, on average, how many hours of sleep would you say you're getting each night? Over the past month. Okay. Is there any reason that you've been unable to fall asleep? Okay. How has your diet been? Have you been eating a balanced diet? Okay. And have you been getting a good amount of protein and calcium in there? Okay, good. Have you had any alcoholic beverages? Okay, that's completely fine. It's just standard question that we have to fill out. Have you smoked any marijuana? Okay, that's good. Any other drugs or substances? No. Okay. Yeah, just your prescription, that's fine. Are you taking any supplements currently? Okay. Firstly here, I am just gonna go ahead and listen to your heart. So just go ahead and breathe normally for me. Okay. Yeah, just go ahead and breathe like you normally would. Okay. Okay, good. I'm gonna come over to that side. Okay, good. Now I want you to just go ahead and take a couple deep breaths in and out. I'm gonna go ahead and listen on your back, okay? Just to make sure that everything is good with your lungs, okay? Okay, and out. Alright, one more. And out. Okay. One last big breath for me, okay? want you to switch to the left finger, so this one right here. Start following this one. Perfect, perfect. Amazing. You're doing so well. Awesome. Okay. That was perfect. That was perfect. You did perfect. So let me go ahead and write down the results for the first test, which you did incredibly. So no complaints there. How are you feeling? Okay, good. No, there is nothing to worry about. I am seriously here to help you. That's our only concern right now. Okay. Awesome. You got an excellent score on that. This next one is also going to be pretty simple, okay? Right here I have this big flashlight. As you can see, I'm going to shine the flashlight into your eyes, okay? And what I want you to do is, with your eyes closed, tell me when the flashlight crosses your eyelids. You're going to give me a number at the end, okay? Yeah, don't worry about doing it in the middle. You're going to give me a number of how many times the flashlight crossed your eyelids, okay? So go ahead and close your eyes. 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 Alright, you ready? Eyes closed. Okay, keep them closed. And we're going to begin. Okay. Alright, yeah, just keep a mental note of how many times it's passing. Okay. I know it's not super bright, but that's part of the exam. Because you should be able to tell. Anyways. Okay. How many times was that? Okay. Okay. Well, I'm not going to tell you if that was correct just yet, okay? No worries. I just can't disclose. But at the end of the exam, I'll go ahead and give you the results, alright? Yeah, you did do great on that first one, but that was just a warm-up, so I wanted to let you know you were doing well. But for the rest of these, I can't disclose, because they're a more serious part of the exam, okay? I'm gonna go ahead and work with the flashlight one more time, but this time I just want you to give me a verbal yes when the light crosses your eyes. I'm gonna have the flashlight cross your face, but sometimes the light's gonna be off. Okay, so for this one, you can keep your eyes open. Okay, this is gonna be an open test. Yes, we're gonna keep your eyes open for this one, if that's okay. And you're gonna go ahead and tell me when the light is on versus when the light is off. Alright, let's get started. Yes. Yes. see how your eyesight is functioning. Because if your eyesight's not 20/20, since your eyesight was 20/20 last time I saw you, that could be an indicator, yes, of the issue being with your cranial nerve. Oh yeah, the cranial nerve being damaged can cause all kinds of issues, but a lot of them do have to do with your eyesight and your senses. Okay, specifically your sense of touch and your sense of sight. Sometimes people have issues with their sense of taste and smell, but that is not as common. And ever since COVID, we don't use that as a test anymore because it was getting confused with COVID. So we're gonna go ahead and do the eye exam here. Yes, so as you can see, we've got a whole host of letters here of different sizes. All I'm going to ask you to do is tell me which letter I'm pointing to. Okay. Alright. So, the first one is right here. What letter is this? E. Correct. Yeah, that one. If you can't see that one, then you're basically blind. So, yeah, wasn't too concerned about that because everyone should be able to see them. Alright, what about this one down here? Do you see this one? I'm circling it with the pen. Yeah, I know, we're going to a harder tier here. I'm gonna jump around, so don't be alarmed. But do you know what this letter is? I'll give you a second to take a look. Correct, that's also E. So, that's good. What about this one here? This one right here. Could you tell me what letter that is? C. Correct. Yeah, you're doing really good. lastly, what is this letter? This letter. Can you tell me what is this letter? Right here. No, that's not an O. That's not an O. Very close, very close. I'll give you one more chance because this is a little bit tricky. It's a C. Yeah, correct. There's a little bit of a space right there, but it is hard to see because it's far away. But I'll give you a pass on that one if you can guess this one. This one right here. Can you see it? Yeah, it's 2 over from the O. Sorry, from the C. Now you got me messed up. What's this one? Right here. Correct, it's a T. Alright, beautiful. Let me go ahead and get your results from that. Mark down in the chart. Okay. Alright. You're doing so amazing. Okay, I know this can be a little bit monotonous. But you're plowing through it, and we're almost to the end here, so thanks for being so patient with me, especially since I was late to come in today. Alright, I got your results marked down for all of those tests. We're gonna go ahead and move on to a feeling test, where I'm gonna ask you if the object I'm poking you with is sharp or dull. Okay, dull. Yeah, this is very important for seeing if the cranial nerve is causing some issues with the nerve endings, specifically in the right arm that you said you were having issues with. Yeah. We're gonna see if those nerves are able to feel the difference, because that's a really common thing. You don't completely lose the feeling, but you might not be able to feel exactly what stimuli are occurring. So this will help us narrow it down. This pen here, that's going to be the dull object, and I'm going to touch you with the sharp tip of these tweezers, and that's going to be the pointy object. Okay, and I'm going to have you tell me if you think I'm touching you with the dull or the sharp, the pen or the tweezers. But I'm gonna need you to have your eyes closed, obviously, so you can't see which one it is, okay? Alright, go ahead and shut your eyes for me. I'm gonna ask you to go ahead and extend out your right arm for me. Your right arm, go ahead and extend that out. Yes, very good. Alright, now I'm gonna go ahead and begin this test, and you just tell me when you feel it, okay? Which one is that? Okay, good, that was the pen. Which one is that? No, okay. That one was actually the tweezers, not the pen. No, that's okay, don't worry about it. We're gonna keep moving forward, and you just tell me which one you think it is. Don't worry about getting it right. That's the point of the test. Okay. Yes, that was the dull object. Okay, no, that was actually the pen, not the tweezers. Okay, not the tweezers. We're gonna do one more. No, okay, that was actually the tweezers, not the pen. Okay. No, that's okay. I am here to help, okay? So don't you worry. No worries about that. We will talk about what that So it looks like you got a better result on your left arm than your right arm. No, that's okay. That's important information for me to have here, so I will fill you in at the end of the test of what I think could be going on. So don't worry. Nothing bad, nothing bad. But that was an important one to rule some things out, okay? Alright, we're gonna go ahead and do an audio test. A hearing test, rather, for you. This will really get to the bottom of what exact nerve issue you're having, if it is cranial. I'm gonna go ahead and make some sounds on your left and your right side, or your right and your left side. Sorry, you're the opposite from me. And you're gonna tell me which side you hear the sound coming from, okay? That's all you have to do. That's all you have to do, is tell me which side you hear the sound coming from, okay? We're gonna do a couple different sounds. Alright, so go ahead and close your eyes, close your eyes. Close your eyes, close your eyes, close your eyes, and let's begin. Alright, so you just tell me left or right, okay? Good, good, good. That's on your right side. Good, good, good. That was your right side again. Good, good, good. That was your left side. Good, good, good. That was your left side. Good, your right side. Very good. Yeah, that was a trick question because that was both sides, both sides, both sides, but that's good that you knew that. Okay. I'm gonna go ahead and make a different sound now. Okay, so keep your eyes closed for me. But I'm gonna go ahead and just make a different sound so we can make sure that you're able to understand the direction of sound in all frequencies, okay? Yes, yes, that was your left side. Correct, correct, that was your right side. Correct, that was your right side again. Correct. Okay, we're gonna do just one more sound, okay? Correct. Correct. That's your right side. Correct. That's your left side. Alright. You're all good in that department. So let me go ahead and write that down for you here. No, I really thank you for being so patient with me. I know this exam is a little longer than most people would like, but you're so close to the end. We only have one more test, so thank you. Just getting all your results filled out in the chart here. You did say that your birthday was the 14th, right? Okay, just want to make sure I got that right. I was thinking about some other stuff. Okay. Yeah, my last patient it was a lot of craziness going on, so I'm sorry. A little discombobulated on my way in here. Oh yeah, they were screaming with their vaccine. Their kid was screaming with the vaccine, and it took a long time to get that administered. So. Okay, so we just have one more exam for you here, and this is going to be another visual one, but this is going to actually be testing color blindness. Yeah, have you ever done a color blind test before? Yeah, okay, so you're just going to tell me which number that you see in the dots. Yeah, you know this because you've done it. And yeah, actually color blindness blindness, specifically a certain type of color blindness, can be indicative of inflammation in the cranial nerve, which is what we want to look out for. So, I have a feeling that that might not be what we're dealing with here today, so I feel like you'll probably pass this with flying colors, no pun intended. But, just to finish out the rest of the exam, this is our last one. Okay, so I've been holding this one up for a while. Which number do you see here? Correct, 74. Each time I'll go ahead and trace the number just so that you can see the 74 is right there. Okay. Alright, perfect. Yeah, red and green color blindness is the most common color blindness, so we're testing for that one first. What number do you see? What number do you see here? And yes, they're all numbers. No letters or no shapes, just numbers. 45. That would be correct. We have a 45 right here. Alright, awesome. Let's move on. I know you want to get home. This one here is a different type of color blindness. That's a lot more rare. You should be able to see this one. Yes, 26. Right there. Yeah, that one is usually not as a result of the cranial nerve. But if you couldn't see that, then we'd have some other concerns. Alright, what about this one here? The red-green once again, but this time it's the other way around. Can you tell me which one this is? Yes, correct. It's a 15. 15 right there, as you can see. So it's looking like you don't have any issue with the red-green spectrum, which is good. That one is pretty common though, but you can't tell if it's a red light or a green light, so it's a little difficult. We still wouldn't want you to have that. They do make glasses now for it though, so. Alright, this one should be really easy, but this one, if you can't see this, then I'd be a little concerned. With the green purple. That one, is definitely a lot more rare and could be a sign of something major going on, so. Okay, of course you can see the 6. Yeah, the 6. That's right there in the middle. This one is easy for most people to see. Yeah, the green purple is definitely a lot more rare. Let's go ahead and move on to, that one's falling out of the clipboard here. Let's go ahead and move on to the purple blue spectrum here. Purple, blue, and violet. This is really an important one here because this could give us some important information about your cranial nerve. Okay, so what number do you see in the center of this circle? The center of this circle right here. What number do you see? 9. Good. It is in fact a 9. This one is on the easier end of the blue-purple spectrum. This one right here is definitely the toughest one that we have. What number can you see here? This one is more about the shades of blue. And if you can especially for men, because the shades of blue are more difficult for men to see. Men don't have as high of a range of shade, of ability to see shades of color, so that's really not super concerning. Okay, but this one will really tell us if there's more of a problem. Can you see this one? Can you see the number on this one? This is another blue shade. Yes, it's a 6. It's a 6. Okay, so this one's a bit of an easier version of the blue shade. It's a 6 right there. Okay, perfect, perfect. You can see that one. Okay, we're really close to the end here. Alright, one more for blue-purple spectrum that I want you to check out. What number can you see here? What number can you see here? 7. Good, good, good. 7 is right there. Right there, do you see it? Right there. Alrighty. That is great. No, you did amazing, and thank you once again for being so patient with me today. That is all I have for you. So let me go ahead and get your chart finished, completely filled out here, since you did such an amazing job for me today, trying to get you out of here as quickly as possible. So, alright, just gonna add these numbers up really quickly. It's gonna give us the final score that you had here today. So, for the results of your exam today, this is definitely leading me in the direction that you don't have an issue with the cranial nerve. Okay, we can see that pretty clearly with all the visual and auditorial examinations today. It's not seeming to me, based on these scores, that you should have any issue with the cranial nerve. So you did pass the exam today. One thing I am concerned about, though, is the feeling in your right arm. You did struggle a little bit and had a lower score in the sharp versus dull section of the exam, which was supposed to test the nerve endings in your arm. And because of that, I am more inclined to believe that this could be originating from the sciatic nerve, which is down in your lower back and your leg, rather than the cranial nerve, which we would usually see a bit more issues with eyesight and hearing. And you said you haven't had any issues with your taste either, so even though we don't use it as a metric anymore, so I don't think that you're experiencing an issue with the cranial nerve, which is great. But because of that, I can't prescribe you anything today that's going to help you feel better. What I am going to do is schedule you an appointment with our neurologist, Dr. Paul. He's going to get you tested and going to get you on the right track here for everything that you need. I have a good feeling that you're dealing with sciatica due to the symptoms that you're describing. Also, the fact that it's present on primarily one side. Okay, and have you been having any issues with your right leg at all? Yeah, okay, so I definitely think that you're dealing with a sciatic nerve issue here, which is actually a lot less serious than the cranial nerve, believe it or not. So no need to worry about that, but we can just go ahead and get you in an appointment with Dr. Paul to confirm that diagnosis for you and get you some anti-inflammatories, which is going to help you feel a lot better. Okay, so when can I book you an appointment with Dr. Paul? Do you have any availability next week? Okay, that's no problem. Yes, I do have openings on that Tuesday. Would you like something that's in the morning or in the afternoon? Okay, I hear you. Yeah, I'm not an early riser either, even though I have to be to get to work, so. But if it was up to me, I would be in the same boat as you. Alright, so we will get you in on that Tuesday the 29th at 3 p.m. Okay, sounds so good. It was a pleasure seeing you in again today. I'm glad that everything aside from this issue is going